Welcome to HomeoVision YouTube channel. We are back with our Organon of Medicine and Homeopathic Philosophy lectures. In this lecture series, we will be discussing the case-taking aphorisms, and in the consecutive videos, we will be covering all the aphorisms related to case-taking. I am Dr. Gauthami B Deshmukh, and let us now learn the case-taking aphorisms. The case-taking aphorisms are numbered from aphorism number 83 to 104. These are the case-taking aphorisms. These aphorisms are important for both your UG theory exams as well as AIA PGET. In your theory exams, board UG exams, we can expect 10 mark and 5 mark questions coming from this particular concept, and for AIA PGET or any other competitive exams of homeopathy, we can expect statement questions, assertion reason questions, and incorrect and correct statement type of questions from this concept of case taking. Let us start with our first case-taking aphorism, which is aphorism number 83. Here, he gives us a brief description about, Hahnemann gives us a brief description about what case-taking is and what are the prerequisites of a physician before he enters into the act of case-taking. Let me read the aphorism for you first. This individualizing examination of a case of disease, for which I shall only give in this place general directions, of which the practitioner will bear in mind only what is applicable for each individual case, demands of the physician nothing but freedom from prejudice and sound senses, attention in observing, and fidelity in tracing the picture of the disease. Now let us divide this aphorism into two parts. So till here is going to be the first part. So he defines case taking as an individualizing examination of a case of a disease. So here we see that according to the concept of disease in homeopathy, we know that even if two persons are suffering from the same disease diagnosis of typhoid, our questions to each patient will be tailor-made, will be individualized, and the remedies that we will be prescribing for two patients with the same disease diagnosis is going to be different. So therefore, just like how disease is individualized in a patient, and just like how the remedy that we give is also individualized to a patient, the art of case taking, the way we frame questions, or what questions we frame, or what questions we ask a patient is also supposed to be individualized. We have to adapt to every case of disease. So when we say case of disease, just like I said, no two persons are same on this earth. Even twins are different from each other. Similarly, two people suffering from bronchial asthma will have to be given different remedies, and similarly approach to their case is also going to be different. So therefore Hahnemann calls this as individualizing examination of a case of disease. Two people suffering from bronchial asthma will not get a standardized questionnaire being asked to them. Depending upon their case and the presentation of their disease, we will have to adapt our questions and ask different questions to each one of them. So he says case taking is an individualizing examination of a case of disease. So here we see that there is no standard questionnaire. We do not have a set of questions that we can ask every patient who comes. We will have to adjust and adapt to the patient and ask relevant questions to that particular case of a disease. So this is the individualizing examination of a case of disease, which is nothing but case taking, says Hahnemann. Further, he says that for which I shall only give in this place general direction. So whatever directions or whatever instructions that he is giving in these aphorisms of 83 to 104 are just general directions, of which the practitioner will bear in mind only what is applicable for each individual case. Say for example, he has also given details about what type of questions about the menstrual cycles are to be asked. We cannot ask questions about a menstrual cycle to a man, can we? So we will have to strike that off from our case taking pro forma. So that is what he says. I have given only general directions here in these particular aphorisms, but we will have to tailor make the questions while receiving the case from each patient. So only general directions are given. We will have to revise and adapt these questions to the needs of the patient. So this is what is given in the first half of aphorism number 83. In the second half of the aphorism number 83, Hahnemann talks about the requisites that a physician must have. Requisites of a physician for the act of case taking. So he says the physician must be free from prejudice. So he must have freedom from prejudice. He must be in sound senses, meaning good judgment, good comprehension. He must be in a state to understand the patient well, to comprehend the patient well, and to respond to the patient properly. So this is what sound senses means. Attention in observation, meaning there has to be no distractions. The physician must not be thinking about something else while he's taking the case from a patient. And lastly, there has to be fidelity. Fidelity in tracing the picture of the disease. Now, what is the meaning of this word prejudice? Prejudice means having a preconceived opinion. That is, we're already biased. So there has to be no bias. No bias, no preconceived notions. As in, we should not judge the patient even before we listen to him completely. Do not jump to a remedy. Do not jump to a diagnosis as soon as you see a few symptoms of the case. So always listen to the patient completely. Only at the end of the case taking, we are to analyze the case, analyze the patient, and then come to a remedy. So sound senses, attention and observation, and lastly there has to be fidelity in tracing the picture of the disease, which means fidelity, which means there has to be faithfulness. Faithfulness. So in order for the patient to trust you completely, we must also show that we are recording all the symptoms of the disease and of the patient in a faithful manner. Just to fit a particular remedy to one particular patient, we should not be omitting or we should not be overseeing certain symptoms. We have to faithfully record all the symptoms and faithfully come to a conclusion or come to the correct remedy, even if it takes a lot of time. So this is what faithfulness in case taking and prescribing means. So this is the introduction to case taking, which is aphorism number 83. Going ahead, we have aphorism number 84. In aphorism number 84, how is the physician supposed to behave, or what is he supposed to do while during the act of case taking? This is what is told by Hahnemann in this particular aphorism. So let me read it out for you. The patient details the history of his sufferings, which means that the patient narrates his complaints, correct? Those about him tell what they heard him complain of, how he has behaved, and what they have noticed in him. Then the physician sees, hears, and remarks by his other senses what there is of an altered or unusual character about him. So we get details of the patient from three sources. Now, what are these three sources? First is the patient's own narration. Okay, narration by patient. The patient himself is going to tell you what is bothering him or what is troubling him. Second, his attenders, those who are around him. Those about him means those who are around him, his guardians, his caretakers, or his friends, or even his family, spouses, relatives. So those who are around him, they are going to tell you about what they have observed, or heard the patient complain of. So these are the attenders or the bystanders, basically. Attenders, bystanders, caretakers, family, anybody. So they are going to tell you what the patient has been complaining about. And lastly, the physician himself is going to make certain observations and note down certain unusual characteristics. Any change in the normal pattern of behavior or normal pattern of physiology is going to be noted down by the physician himself. So three sources of information that the physician gets during the case taking is The first thing being the narration of the patient himself. Second is whatever the bystanders or those around the patient have observed in him. And lastly, the physician himself is to observe. The physician sees, hears, and remarks by his other senses what there is of an altered or unusual character about him. He writes down accurately all that the patient and his friends have told him in the very expressions used by them. So the same expressions which are used by the patient and his attenders or bystanders are to be noted down. So while doing the case taking, always make sure to use the same expressions that the patient or his attenders have used. We should not try to introduce medical terminologies or diagnosis right at the point of case taking. Analysis, diagnosis, and remedy conclusions has to be done at the end of the case taking. In the beginning of the case taking, we must avoid using medical terminologies or medical jargons. Okay, so the very expressions used by the patient and his friends has to be noted down while the physician is doing the case taking. Keeping silence himself, he allows them to say all that they have to say and refrains from interrupting them unless they wander off to other matters. So this is again another important point. So the physician is supposed to keep himself silent. The physician is supposed to keep himself silent and do not interrupt the patient. Do not interrupt the patient and allow them to talk all that they want to do, all that they want to tell you, and only interrupt unless they wander off to some other irrelevant topics. Okay, so only when they start talking about something that is very irrelevant, till then, unless and until the patient is talking about himself or his complaints, do not interrupt. The physician is supposed to keep silence during this period of time, and he is supposed to interrupt only when the patient starts talking about irrelevant matters. The physician advises them at the beginning of the examination to speak slowly. So because the physician is making a note of all the complaints, symptoms of the patient, the physician initially itself advises the patient to talk a little slowly in order that he may take down in writing the important parts of what the speakers say. So this is your aphorism number 84 proper. Here we see that we have three sources of information that the physician gets during the act of case taking. One is the patient's narration, second is the attender's observations, third is the physician's observations, and then in the next point, he says that the physician is to write down everything accurately. After that, how is the physician supposed to behave? The physician is supposed to keep himself silent, do not interrupt unless they wander off to irrelevant matters, and lastly, it will be better for the physician to advise the patient to talk slowly at the beginning of the case taking itself, so that he can note down the important points of whatever the patient has to say. Continuing, there is a footnote to aphorism number 84. So here he says, why should the physician not interrupt while the patient is talking? So why should the physician not interrupt while the patient is talking? Why? Because every interruption breaks the train of thought of the narrators, and all they would have said at first does not again occur to them in precisely the same manner after that. So say for example, you're talking something and I interrupt you. And what happens at that point of time? Of course, you will answer to my question or you will respond to whatever I have told in between your narration. But then again, when you try to recall the same points that you wanted to speak, you will not be able to get them in the same order that you intended to do in the first place. So every interruption is going to break the train of thought of any narrator for that matter, not just a patient or not just anybody who is ill. It is about this is about the art of talking and listening. So even when I am teaching something, if a student interrupts, what happens? I will lose my train of thought. I will have to fumble around and recollect all the points that I wanted to tell all over again. So the interruption basically causes a break in the train of the thought. So this should be avoided. So this is aphorism number 84. Next, we have aphorism number 85. So in aphorism number 85, we just have two important points that we have to remember. That is, Hahnemann advises the physician to start every new complaint should begin in a fresh line. Do not put commas, do not put hyphens, do not put colons, do not put semicolons, and write down the complaints in a paragraph format. Always make sure that every new complaint is written in a fresh line or in a new line. And why is this to be done? Let us read the aphorism. He begins a fresh line with every new circumstance. So every new circumstance meaning every new symptom is to be written in a fresh line or a new line. Do not continue the respiratory complaint and the gastric complaint in the same line. Make sure that you have left a few lines in between, or at least go to the next line and write about the gastric complaint or the sleep complaint. Do not mix all of them in a paragraph format. And why is this? With every new circumstance mentioned by the patient or his friends, so that the symptoms shall be all ranged separately, one below the other. So one reason is that all of them can be seen separately, one below the other. He can thus add to any one that may at first have been related in too vague a manner, but subsequently more explicitly explained. So he says, sometimes what happens is that when the patient is talking, they might only give a little information about their respiratory complaint. They will suddenly shift to complaints about their sleep, and then again they will come back to the respiratory complaint and they will start narrating about that particular breathing difficulty or coughing in much more detail. So when this happens, when we leave some space between every new complaint, or when we begin every new complaint in a fresh line, we will have space to add more information about that complaint in that particular section itself. So this is why we have to start every new complaint in a fresh line, so that when the patient, if the patient at a later point of time adds more information about an initial complaint that he had narrated earlier, we will have space, and we will have space to add more information of that particular complaint in that particular section itself, and we will get the complete symptom in one section of the case sheet itself. So this is the reason why every new complaint should begin in a fresh line. Going ahead, we have aphorism number 86 and 87. So aphorism number 86 goes like this. When the narrators have finished what they would say of their own accord, the physician then reverts to each particular symptom and elicits more precise information respecting it in the following manner. The aphorism continues in the next slide, but let me split it off here. So Hahnemann here says that when the patient has finished whatever he has to say of his own accord, meaning of his own will, okay, we do not interrupt the patient once he starts talking, and we let the patient finish whatever he wants to say, and at the end of this, his own willingful narration, we will again go back to each particular symptom that we have noted down in an order, or that we have noted on in a chronological order. We will go back to each particular symptom and we will start eliciting more precise information, more details about that particular complaint in order to form a complete symptom, so that we can get a complete symptom. And this is what is going to help us in our prescription. So this is what is to be done. So some examples. So after the patient has finished whatever he wants to say out of his own will, now the physician can go back to each particular symptom that he has already noted down in an order and elicit more information. Elicit as in ask more questions about those particular symptoms and make sure that we get a complete symptom. Basically our LSMC, we are trying to complete this symptom by taking all the elements of an complete symptom. Adding to this, he says, what is to be done by the physician? How do you elicit more information about each of the symptoms that were already narrated earlier? He reads over the symptoms as they were related to him one by one, and about each of them he inquires for further particulars. So he will refer to his case sheet, he will start reading each symptom one by one, and he will start asking extra questions about those particular symptoms which were already narrated, for which he will get answers from the patient and thereby he will be able to form a complete symptom out of the incomplete symptoms that the patient had narrated. Some examples are given. Example, at what period did this particular symptom occur? So what type of extra questions or what type of particular questions can we ask in order to complete the symptom that is narrated by the patient? So these are some of the examples that Hahnemann has mentioned in aphorism number 86. For example, at what period did this symptom occur? What is previous to taking the medicine he had hitherto been using? So what was there before what symptoms were there before he was taking these medicines? What symptoms were there while taking the medicine, or only some days after leaving off the medicine? So, or did these symptoms occur after leaving a certain medicine that the patient was taking previously? What kind of pain, what sensation exactly, and was it that occurred on this spot? What was the precise spot? So the exact location, exact sensation. Did the pain occur in fits or by itself at various times? So we ask if the pain was intermittent, or was it continued without any intermission, or was it a continuous type of a pain, and for how long, for what period of time did the pain last, at what time of the day or night, and in what position of the body was it worse or ceased entirely? So we ask for modalities. When has it been more? When has it been less? What was the exact nature of this, that, or circumstance mentioned? So described in plain words. So all of this has to be asked, and we have to ask all of these questions while avoiding medical terminology in plain words, in a language that is simple and understandable to the patient. So these are the kinds of extra questions that we can ask the patient to elicit more information, more precise information about the symptoms that the patient has narrated earlier. Going ahead, another very important aphorism that we have here is 87. So aphorism number 87, Hahnemann tells us that while we are questioning a patient, we should not ask questions that suggest an answer to the patient. And these are called as leading questions. Leading questions are to be avoided. So what are these leading questions? Leading questions are yes or no questions, or these are questions that suggest an answer, to the patient. So questions should not be formed in this way. Questions are not to be formed in a way such that it suggests an answer, or such that the answer of such a question is a yes or a no. So, and thus the physician obtains more precise information respecting each particular detail by asking more questions, the examples of which were described in the previous aphorism, which is 86, but without ever framing his questions so as to suggest the answer to the patient. So never frame the questions in such a way that it suggests the answer to the patient, so that he shall only have to answer yes or no. So no yes or no questions are entertained, else he will be misled to answer in the affirmative or negative something untrue, half true, or not strictly correct, either from indolence or in order to please his interrogator, from which a false picture of the disease and an unsuitable mode of treatment must result. So, when we ask a leading question, there is an yes or no question, or a question that suggests an answer, a faithful or a truthful reply will not be obtained from the patient. Either they will answer yes, that is affirmative, or negative. So either they will simply say yes or no, or something that is going to be untrue or half true, something that might not even be correct, and this can happen just in order to please the interrogator. So just in order to please the physician, the patient may say yes or no, or sometimes out of laziness, out of indolence, out of inactivity, out of no interest, the patient might just simply answer yes or no, not knowing the importance of the answer, of his answer to the question. So when this happens, so when we ask leading questions, this will give us a false picture of the disease, because the patient will be obliged to please the interrogator, or out of his laziness he might not answer correctly. So what happens? We will get a false picture of the symptoms. So when we get a false picture of the disease, our mode of treatment will also become unsuitable, because we will not be able to prescribe him the exact similar one. So this will not lead to the highest ideal of cure. So therefore, while framing the questions, we have to make sure that leading questions are not asked. We should not ask questions which suggest an answer to the patient, and we should always avoid the yes or no questions, because all of these type of questions will give us untrue or false answers to the questions that we're asking about these symptoms, and this will give us a false picture of the disease, and with the false picture of the disease we will end up making incorrect prescriptions which will not help the patient. So with this, let us end this video over here. We will continue the subsequent aphorisms in the next part. Thank you.